As a patient with a rare chronic condition who relies on the healthcare system, the opportunity to co-design a continuity of care companion guide for patients and caregivers was very appealing to me. I was convinced that this approach would make it relevant to patients and caregivers, and I wasn't disappointed. Collaborating with a group of Ontarians on a citizens advisory group, people who bring such diverse patient and caregiver experiences, was an enriching experience. The support that we had from the college and our facilitator enabled us to share our perspectives and learn from each other. The process they adopted is truly a model of co-design. I've read many guides during my long healthcare journey, but this one is quite different. It feels like a conversation between doctors and patients and their caregivers. Rather than produce the standard how-to guide, the co-designers have opted to provide patients and caregivers with the information that they need to better understand the responsibilities of their doctors at different points during their care. Practical information such as who is responsible for reporting my test results? What can I expect when I'm discharged from the hospital? What is my doctor's responsibility when she or he is away? What happens when I'm referred to a specialist? And so many more are incredibly useful. The printable tools such as health summary and hospital discharge information will also be helpful. We hear a lot about how patients and caregivers should work in partnership with their healthcare providers, but my experience has shown me that in many instances, it's easier said than done. The fundamental principle of successful partnerships is mutual respect, and I think that this guide will go a long way to fostering this because knowledgeable patients who understand how the system works are well equipped to partner with their doctors. I find the transparency of this guide quite remarkable. And as they say, knowledge is power. For me, the guide is a snapshot of the key responsibilities and duties of physicians. This is what is expected and realistic. This is what is beyond the control of individual physicians. And here are the tools that patients and caregivers can use to work in partnership with their doctors. I really hope that the guide will go viral.